Uh, Thank you for all the work you're doing, for your expertise, for your careers. I hear the experience. Having now here representing the public comment area, the public behind me today is one of the largest community engaged studies in U.S. history, funded by SAMHSA and NIDA in 4 states, called the Healing Community Study, in 67 communities. Some 200 investigators, 40 of those from New York, and our colleagues at Columbia, Miami, Yale, the City University, NYU, Einstein, but also our critical partners, government partners at the Department of Health, OASS, and OMH, have been critical to the understanding that we've been able to achieve over the course of the last 3 years as we've implemented a community-driven, evidence-based approach by engaging data to make decisions around evidence-based practices in 16 New York State counties. I come here, and many of your faces, it's great to see you today and all the work you're doing out there in Buffalo and Monroe and Ulster, our partners in this particular project, as you committed to learn with us, share your vision, share your lessons learned, and we wanted to share today, just briefly, this elevator is very quick, this elevator speech, some of the lessons, and invite and say that we would love to collaborate further with this board going forward. Thank you for wrestling with the difficult questions around the short-term urgency that is needed here in this crisis, as well as the long-term approach. This is an opportunity to transform the system, to not do business as usual, because business as usual led to increased overdose deaths, right? So we need to de-implement what doesn't work, but we need to implement what we know does work. I love Dr. Brown's question was, what is the data tell us about the approaches that we are now recommending? We are now, is a parallel process in this particular intervention was, what data is available to help you make your decisions around impact, around feasibility, and around resources that might be needed. I speak to you today as a research scientist, as a clinician for 33 years in the field of addictions, as a person who has lost 2 members to overdose death, both alcohol poisoning and opioids, but also someone who is very honored to work here in New York State. Today, to be able to witness the first time in the nation where prisons and jails will be required to address substance use disorder and provide medications instead of take them away from people who are incarcerated. How honored to be a part of this date, to share with the nation the lessons learned that we will have now as it's rolled out. How can you make those recommendations and have the funding in communities to help those communities to implement what the legislation says? So the opportunities are many. This particular intervention that we have been testing, called Communities That Heal, is community driven, built on coalitions, task force. Some of them 15, some of them 40 members, from stakeholders, people with lived and living experience, from BIPOC communities, making sure diverse voices are at the table. This is not always easy. When you're in Chautauqua, you're in Lewis County or Suffolk, all various needs and resources available where decisions are sometimes challenged. So we know that it's important to have a data-driven approach. So what is that? It's looking at what is the state level data, working with our partners at the Department of Health, with OASAS, really bringing together that data, breaking down silos of data, where criminal justice, Medicaid will share those data so that communities can make those decisions effectively. You need to help us do that with system change. And where can you put those funds to make that system change? The local data, what capacity do they have to collect the data? Is the ME actually doing the death investigation effectively and reporting that data back so the community can know, what are they responding to? How many people did overdose in the last month, right? And how do we make sure those voices are heard so that they can make those effective decisions? We're able to develop a dashboard and portal for our communities, and we're working with our departments at the Department of Health to see how those dashboards and portals may be sustained going forward. And building capacity of looking at data in communities. Many organizations said, we have data, we don't know what to do with it. Can you share with us? Can you teach us? Can we be trained together to do that? We develop community collaborative, learning collaboratives so that people can share lessons learned. Urgency in a crisis can be an opportunity, as we know that. COVID taught us that we can not only deal with one public health issue at a time, we can deal with overdose and COVID at the same time. As a matter of fact, we know that COVID led to greater overdose deaths because issues around isolation and service disruption. So what can we learn from that as you're making decisions and recommendations today? We know that additionally that communication and stigma reduction are critical. How do you get people into care? How do you make sure that substance use disorder and substance use can be talked about, where shame of receiving treatment can be reduced, or where harm reduction messages can be actually accepted and utilized? So where does the approach come in? I like when you said the urgency. What is the urgency? Josh is saying, what do we need to do now, right? We know harm reduction works. How do we keep people alive? What are the tools and methods to do that? How do we find out, by the way? That means going to the people who use drugs, those families who have experienced it, and asking them directly, what are the solutions you think will work while you're doing that long-term planning? How do you find this out? By building those community coalitions, build and work on coalitions that exist in communities already. Don't reinvent the wheel, but certainly work with them as they're doing more of a data-driven approach, as they're looking at evidence-based practices and actually deciding together what is effective, what's not effective based on the evidence. So I would say to you, basically in closing, there are many opportunities, and we welcome the opportunity to continue to discuss, to share lessons learned from our communities as we continue to implement in our second wave of 8 counties now through December 2023. And we want to know that this is an urgent matter. First, that we need to make sure we engage communities and those communities of color that are disproportionately now being impacted, that we need to let the data guide us, that this public health strategy needs to be an integrated strategy with co-occurring disorders. And yes, we may say that's okay and that we are promoting it, even that our licenses are now starting to generate and to promote, but when it comes to practice, there are many barriers that need to be addressed. You can't just throw money at an issue without also providing implementation support. We hired a nurse practitioner in an ER with the clinic director on board. A year and a half, not one person was referred for medication for opioid use disorder because of barriers like stigma, workload, and those other kinds of things. And then finally, we are invested in also supporting the workforce. It is a crisis in this state. We have one county we're working with a part-time female peer outreach worker for the entire county, right? Engaging people once they leave jail, linking them to care, one part-time, right? So what are they supposed to do? Those counties that don't have methadone, thank you to the state for those innovative strategies around mobile methadone. We have a lot of work to be done there. And finally, the support of those jails and prisons as they initiate this legislation. It is an amazing opportunity to learn from them, but we've had counties that said, I did not want to discuss this at all, and now have put together a plan and saying, how can you help us with funding and training and implementation support? So let us learn with them together. Let us invite us back to discuss these issues further, and we welcome the opportunity to share with you ongoing lessons learned and looking at what the data tells us and how we can, again, as New Yorkers, lead the nation in this approach. I'm so proud of the work you're doing, so proud of our counties, and continue to invest in this work together, and thank you very much.
Thank you. Thank you. Thank you for all the public comments. I don't know about you guys, but we actually got a compliment